Welcome back to Menopause Stories podcast. Alrighty, so I brought on one of my personal friends. This is Dr. Janika Benoit. I'm gonna have her introduce herself, and then she's gonna be telling us about her story. I'm gonna have her just introduce herself to you. She's someone who I've known for over 5 years now. And she's a real fervent and a big supporter of those of us who are going through the menopause stage, because she's one of those docs out there that gets it because she's also taking care of the ladies in her area and in her neighborhood. Alrighty, Dr. Ben, go ahead, introduce yourself to those ladies who are listening to our Menopause Stories podcast.
Absolutely. Thank you so much, Dr. Tamara, for having me on. I love spending time with you. This doesn't even feel like work. It feels like, two girlfriends hanging out. I am
Absolutely.
Dr. Janika Benoit. I am a board certified internist and sports medicine physician. I I really got my start very early as a child being involved with medicine because my father is actually a physician. And so I was able to be underneath his wing, seeing how he worked. He owned his own practice. And so seeing him own something that was his, and then also being able to travel with him while he was with his children and still working on his practice while on vacation, that always inspired me. And so here I am doing something very similar because I now have my own telehealth practice that focuses on weight management for women and with an extra focus on cardiometabolic health and muscle health as well. And so a lot of my patients are experiencing and menopause. And so helping them understand their cardiometabolic risk and helping them understand their muscle health as it involves the changes that are happening in their body is extremely important and also very fulfilling for me.
Absolutely. Because that's the thing about this menopause, perimenopause journey. So many things are changing in our bodies. Like so many like the weight, the way that we respond to the way we respond to exercise. Our bodies, it's like sometimes we might even like get this feeling as if your body just gave up on you. But we know deep down that's not what's happening. There are so many things that it's just hormonally, we're just going through that phase. But let me know from your personal experience, was the determining factor that when you looked at life and you were like, wait a minute, something has changed. This is not acting the way it normally does. Tell us that part of your story.
Yeah, so I remember in my mid-30s, I had gained 20 pounds, and this happened very gradually. I just noticed that very slowly I started, trying on some clothes, and I was surprised that these clothes that used to come above my waist could no longer come above my waist. And I had to do a double take, like, is this the correct pants that I used to wear that used to fit
Mhm,
so well and now don't fit? And I am someone who has always been physically active.
mhm.
I even was a personal trainer before medical school, and I'm a sports medicine physician. And I just really just have always been very active. And, I thought I knew what to do. And so, I pulled out all my old tricks, right? I started increasing the frequency at which I worked out. I really started monitoring the way that I ate. And I realized that even with all of that was not working. And, with me being very type A, I started going very extreme, like to
Mhm.
even really restricting my caloric intake while exercising more than I did. Right. And so that's why I also empathize with a lot of high achievers because sometimes, especially when we recognize that our bodies changes, we may go to those extreme levels because we are seeing that something is not working, and therefore we know our ability to work hard and to be able
Mhm.
to get things done. And sometimes it is at our own detriment. And even me as a physician, I was working really hard on trying to change my weight, and
Mhm.
the things that I was doing was not working.
So you
And
weren't using like your go-to. Okay. I know that if my weight went up, I do A, B, and C, and I get it back under control.
right, I was like, "Oh, maybe it's my carbs. Let me minimize
Mhm.
my carbs. Maybe I'm decreasing some carbs. Is it my strength training? Okay, let me increase my weights, right?
Mm.
And so those were some of the things that I did. And even I tried to minimize my caloric intake. Let me look at the frequency at which I eat. Okay, let me minimize the calories that I'm eating. And even despite all of that, initially it was not working. And so I realized
Mhm.
that something was changing in me
You're right.
and I was very determined to figure it out.
Wow. I'm glad that you're telling this story because so many women, as you mentioned, those who are even like type A or just very self conscious and know their body. So, when I'm saying self conscious, this is not to say that you are insecure.
Mhm.
You're self conscious because you're self aware. You're self aware about what goes on inside your body. And if there's a change, you acknowledge like, wait a minute, something it's not right. And you, as you mentioned, try to alter some of the external factors to see what are these external factors that I have control over that can possibly help to alter this to get it back to the way that I know. But then there's this other thing that's going on inside your body that you're just not was not probably one of the top things that came in your mind, right? Was hormone and hormonal changes something that came at the top of your mind during that time?
Absolutely, absolutely, especially with everybody talking about perimenopause and, I was like, "Okay, is this what I'm experiencing right now?" And so I was absolutely thinking about if that could be a contributing factor,
Mm,
and I didn't go as so far to, request any hormone replacement therapy.
mhm,
However, I was thinking about being started on a GLP-1 for sure.
mm,
That certainly came top of mind for me. And
mhm.
so I was close to requesting a GLP-1 just because I felt like I was hitting myself against a wall. And I
Wow.
thought that, I had arrived at a point within my, trajectory of me being a woman that I'm at a point where no matter what I do, that it cannot work. And
Wow.
so before I decided to try a GLP-1,
Mhm,
I really wanted to really take a deep dive into what was going on, even
mhm.
from the psychology aspect, right? It's just,
Absolutely.
okay, let me take a complete look at what was going on, not just what I'm taking in from a nutritional aspect
Mhm.
or my energy expenditure from a movement aspect, but let me look at holistically what is going on. And so that is where I started.
Wow, wow. Now you've noticed you've had some results from doing that, right? And then
Yes.
you've also had the ability to help your patients who might be going through something similar.
Mm.
Now, do you have any patient that came to mind? Of course, we're not gonna we're doctors, so we're gonna tell you the story. We're not gonna tell you the person directly so we can keep HIPAA compliant. But is there any patient that comes to mind that was going through this process of perimenopause and menopausal journey that, you were able to help to support them through that part that can help those who are listening to know that, listen, you are not alone, woman. You are out there. If you're feeling this way, it's not just you. Let's hear that story.
Absolutely, absolutely. I did have a woman in my practice, and
Mhm,
she already came to me already on hormonal replacement therapy.
mhm,
However, the reason why she came to me was that she wanted to gain muscle. And so we know that during the menopause transition, there are changes in body composition, right? There
mhm.
is a loss of lean mass and there is increase of visceral fat, right? That
Right.
inflammatory type of fat that can predispose you to metabolic syndrome. And
Mhm.
so she wanted to gain muscle. She was already on hormone replacement therapy. However, as you know, the most important aspect of medicine is really taking a good history, right?
Yes.
And so in taking her history, I realized she was having trouble sleeping
Mm,
and, also with her workouts, she had a lot of post-exercise muscle soreness, okay? And so, with
interesting.
that, I told her to decrease her workouts, right? And she's a
She
lot of
looked at you like you were crazy. "What do
exactly,
you mean? You trying to
yes.
gain muscles and you telling me to not work out?"
Exactly, because she's a high achiever, and so I was like, "Okay, I'm gonna tell you," and so I understood her completely, right?
Mhm,
And so being a high achiever, being type A, wanting to, go for the goal all the time, and I say, "Okay, I want you to decrease your workouts from 4 to 3." She looked at me like, "What?" And I was like, "Yeah, I want you to cut back on your workouts." And so she did, and then slowly over time, she recognized that this post-exercise muscle soreness was improving. Now, the other big thing, which was really, I think, the biggest change in her health was that she was able to maintain her sleep. And with perimenopause and menopause, even though we know that hormone replacement therapy can help with sleep, sometimes it requires a multimodal approach, right? Sometimes we have to use other tools in the toolkit. And so with her sleep, I really got to the root of what was, causing her ability or causing her inability to maintain her sleep. And it was actually stemming from things that she experienced in her past,
oh,
right?
wow.
Things that happened 15 years ago.
Mhm,
And so we were able to address some of the feelings that she was feeling. And because of what she was experiencing in the past, there was this insecurity around sleep where it felt that she had to be on guard, right? Instead of
mhm,
learning how to rest during
mhm.
sleep, she felt that she was being threatened because of what she experienced years ago. And so we worked on that, right? We worked on changing her mindset around that, right? Using different phrases and different thoughts and even creating certain feelings of how she wants to feel when she went to sleep instead of feeling that she was feeling threatened. We really focused on just her posture, right? Because if you feel like you're getting threatened, you may tense up, your
Yeah.
shoulders may come up to your ears. And so we worked on, okay, just recognizing your body posture, right? How
Mhm.
would your body posture feel when you are relaxed, right? And so getting your body prepared to sleep, prepared to rest, right?
Which is
Um, we worked on that. And so even though she was on hormone replacement therapy and even sleep aids, I do believe with cognitive behavioral therapy, and then with the other supplements and medications that she was already on, it really helped to bolster her sleep and allow her to maintain her sleep. And so the point is that sometimes we are on hormone replacement therapy, women are on hormone replacement therapy, but
Mhm,
there may be other things at the surface that can be impairing their ability to really receive the maximum benefit from
mhm.
hormone replacement therapy. So it's recognizing that sometimes it does require a multimodal approach, right?
Absolutely.
Recognizing, okay, what other tools can you pull out the toolkit so we can amplify the hormone replacement therapy and so that you can get the maximum benefit out of it.
You know, it's interesting that you are talking about this person who had a trauma early on in life. I think I read recently, and I'd need to look up the article that says during the perimenopause, even like menopause, like you say, transition, a lot of times some women it resurfaces. It's like some of the traumas that you had early on in life that you felt that you had overcome, that you were able to, move or either push through. Maybe you didn't have professional you didn't have like professional help to get through it, but you were able to get through it. Because a lot of us, we all have drama and traumas in
Right.
our lives, and we push through those traumas. But a lot of that can resurface during this portion of our life. I feel like just losing some of the hormones ability to help us with our coping. I feel like, once our estrogen level starts going down, our progesterone level starts going down, we lose a lot of our coping mechanism. And I think that's what happens to women, why, we start to just feel like we're falling apart. So I can see how even if just getting the hormone replacement, but with having this multimodal approach, it can help to have you get to some of the root causes and to deal with what's going on in the root cause so
Yeah.
that you can feel better. So, It's no wonder for those who are probably listening when you're like, "Oh, all of a sudden ADHD," like, it's becoming such a big diagnosis for a lot of us in our menopausal journey. Because you know what? We were just able to cope. As
Mhm.
a woman, I know I speak to a lot of women, and they will have 8 or 7 different symptoms, but they're like, "No, that's okay. It's not really bothering me that much." I'm like, "What about sleep?" It's not really bothering me. The stress, I just deal with it. How's it affecting your work? Well, I need to work in order to get paid, so I don't let it bother me.
Yeah, that's so true. That's so true.
But it's
Yeah,
your
we just think that, okay, this is what I've always done, right?
yeah.
But then it takes time to really recognize, oh, there is a change here. Like I am not able to cope with this as I have once done. And it's also helping them recognize like it's a problem and it's okay to say that you need help, right? I think
Mhm.
it's giving the space and allowing them to provide the language that, okay, yes, I do need some help during this time. Yes, I have been able to overcome this in the past, but there is something about this now that I'm not able to deal with this as I've once done. And
Yeah.
so that's amazing. Even with the work that you do, is also helping women recognize that, hey, it's okay. Yes, my body is changing. And right now I need help in a different way. So
Mhm.
that is a great point.
Yeah. So I'm glad that we have some women who are coming in and acknowledging, and you're able to help these women in your practice with this phase of life. Two things that I think is so important that you brought up with this patient is one is recognizing that the physical fitness is so important, but the way you go about it also is just as important. And then two, as we were mentioning, bringing up and recognizing the deeper root trauma. So we've just talked about that deep root trauma and, being able to overcome it with the cognitive behavioral therapy, this multimodal approach. But let's not talk about like those women, if it's let's go harder, because you said that in perimenopause and menopause, I'm losing muscles. So I'm going to go hard and the muscle soreness, I thought I was supposed to be sore. So what's up with that?
Yeah. And so this is really good. So I mean, typically during exercise, you can experience this post-exercise muscle soreness. Typically it comes on around like 48 hours
Mhm,
after a workout. However, in this case, it was impacting her ability to recover, right? And we know that during sleep, that is when recovery happens.
yeah,
That is when protein synthesis happens. That is where immune activity happens, right? That is where cortisol is regulated. And
mhm,
so, with her inadequate recovery, I recognize, all right, we need to help with your recovery. And with the fact that you are having this post exercise muscle soreness and it's, lingering
mhm,
and impacting your next workout, and also compounded with the fact that you're not getting adequate sleep, we need to make sure that you are well recovered so that you can function well on a day to day basis, right? So that you can go through your physical activity and not be so sore where you can't even do another day's worth of physical activity. And
right,
so it was really impacting her progress, even her health as well, right? Because type A high achiever, we want to keep on going, right? We
right.
we know that sky's the limit, and baby, we reaching for the sky.
All the time,
Right.
even when my legs ache, I'm still stretching my arms out. I
Right.
said my legs hurt, not my arms.
Right. So it's also recognizing it's not just about the soreness, but also giving your body the ability to recover, making sure that,
Mhm,
you are getting your levels regulated during sleep, making sure that that you're well rested,
mhm,
before your next workout, because it only impedes your progress. And then, there goes the mindset about it, right? And also teaching my patients, okay, not everything you have to go to like balls to the wall, right? It doesn't have to be that way, right?
mhm,
You decide, okay, what is sufficient for you. And it's also helping them understand that with strength training, like
Mhm.
you don't have to exercise until failure. That is not necessary. It's not
Right, it's called strength training.
right.
It's you're telling me that I don't you mean that I don't have to go all the way until, like, I'm crawling out of the gym?
No, you don't. Like, it doesn't have to feel that way. Just because you are not in debilitating pain doesn't mean that you have not worked, right? And
Uh,
so it's also helping women understand, okay, how is a resistance training program structured, right? We do have strength, but we also have balance, right? Which
mhm,
becomes really important later in our years. So
mhm,
that we prevent falls, right?
right,
In aosteoporotic fractures, there's power training
mhm,
that we can do that helps with functionality, right?
mhm,
There is hypertrophy training, which is a form of strength training that helps with metabolic function. And
mhm,
so understanding there's different aspects of a resistance training regimen and also understanding how you utilize all those different aspects. Like I explained, a lot some women think that they have to exercise till failure. No, not necessarily.
mhm,
Especially with hypertrophy training, so increasing the size of your muscles, that is really a volume game. And so when I mean by volume game, you want to focus on your number of repetitions. And so you don't need to have a heavy weight, right? And so
mhm,
because if you are going for repetitions, you don't need to have a heavy weight, which means that you don't have to go until failure. And so you can manipulate the volume by increasing your repetitions or increasing the number of sets, right? And so
mhm,
there are many aspects of resistance training, and
mhm.
it's teaching women that, okay, you don't have to feel like you hurt. You
Or
don't have to
to
feel
be
like you
certified
hurt.
that you've done it correctly.
Exactly,
You
exactly.
know, that I think that this is a great portion to also dive into. Like, a lot of us women, when we're doing our exercise, we have this mindset, which I'm glad that it's starting to change. I'll add that caveat about how we should be exercising. The mindset was two ways prior, which was one, you exercise for its physical attributes because I want to look this particular way, which might be losing weight in order to fit in this jeans because I'm going on vacation and I want to fit in my bathing suit. So I might, hit up the gym right quick for that. Or the other one is like you said for the bulking, muscle bulking, which is just, literally you're working out to have this physical attribute, bulk the muscles, maybe the six pack and so on. But during this portion of our lives, which is this transition journey, a lot of the resistance training, and I like the way that the functional portion is where now we're really highlighting that versus just the physique element. Now, I'm seeing some of the exercises that we did for physique does not necessarily help for function,
That
which
is
is
so yes,
so we're going to the gym and we want to have, the arms and like our ripped arms and our ripped six pack and legs, but then we don't have any hip mobility or grip strength or those things which are important because as we get older, we need to be able to have grip, but we need to be able to have the hip mobility for the movement to even just from sitting to standing, the strength for that. Like so, no, some more functional
absolutely,
exercise to get us through this next phase.
absolutely.
And the functional exercise might not have your body looking like this the standard aesthetic portion that we have been fed in for our twin to look in our 20s. Let's
Right.
speak to that a little bit.
Yes, yes. No, I think this is great. And this is what I tell even, young women,
Mhm,
women in their 30s. Yes, you want to be able to strength train, but we have to understand that when we are focusing on our health, it's really an investment for our future,
mm,
right? And so it's an investment for our future. So thinking about, okay, well, how do I want to feel when I'm 80, when I'm
mhm,
90? Thinking about that. Do I want to be able to, if I need to lift something heavy, do I want to be able to have the independence to do that, right? That I know that I can still rely on myself, that I don't have to wait for a family member to
mhm,
help me, that I am strong enough to, for example, bring my groceries inside
Mhm.
or lift like a heavy box or slide it across the floor, right? And also understanding there's even like a squat, right?
Yeah.
We squat when we sit in a chair, we squat if we're picking up a baby, we squat if we are picking up something off the floor. That is such a functional movement. And
Mhm.
honestly, um, when we are, for example, picking up something off the floor, most times people are bending over, like using their back, right,
Yeah.
to
Mhm.
lift something up of the floor. But instead of using our back, bending over with our back, and then coming up with our back, we can just simply squat, pick something up the floor, and then come up. Right. And so that is also teaching us to use our body in a functional way to be able to engage our core, to be able to use our quadriceps, to be able to use our hamstrings, to be able to pick something off the floor instead of, I'm pretty sure you have seen this in the ER.
Yeah.
Back pain is so chronic and it sometimes it takes multiple modalities to help alleviate chronic back pain.
Yeah.
And I have seen so many times where I've seen a patient before and they're like, yeah, I picked something off the floor, or I leaned over to pick up my baby and then I pulled something in my back.
Yeah.
I've heard
Mhm.
that so many times. And so even squatting to do basic things like squatting to pick something up, squatting to slide a box off the floor, right? Instead of bending over with our
Mhm.
back is so helpful. The squat is such a functional exercise, but sometimes when we see people squat, it's like usually with this heavy barbell.
Yeah.
And like honestly, like we're not gonna be walking around with barbells on our back, right? But we do need to be able to use our body functionally to pick something off the ground or pick up our groceries or be able to raise something heavy off the ground, right? And so being
Mhm.
able to engage our core, right, which is so important with
Mhm.
anything if you're lifting heavy, you absolutely need core engagement to be able to use our lower extremities, quadricep and our hamstrings to and be able to engage those muscles is really, really going to be important. And that's going to help with down the line.
Mhm.
When you're older, you're able to do those things on your own and you're able to
It
um
increases your level of independence,
absolutely.
which is a big thing when we think about us transition. Like, the midlife journey that you're on, you're like, well, how can I keep myself in a position where I can increase my level of independence? And having these functional training exercises that deals with strength, resistance, and function, I think it's a great avenue. So I'm really glad that you're available to help your patients in that realm. So so your patients are very, very, very because ever since I've known Dr. Janika, she's always had exercise is one of the paramount portions of who she is,
It
but
is.
not just that, but no, that, but realistic exercises. And
Mhm.
you've often done that. You have videos out there. If people want to look up Dr. Janika from like years ago, she'll have videos of like, listen, you remember that? Yeah, because you're like, listen, you're at home and you want to exercise, you can just use this broom. And when you do this, when that you have yeah, you're like, listen, you got a 1 liter jug of water and you got another one here. Look, you're doing that. You don't have to, you have all of these ways for you to do functional exercises and you teach it in a way that it is realistic. So not everyone, have money to join the gym, but you're just like, hey, if you look around, there are these things that's in your house that you can use to help to get the same resistance training, to get the same exercise and the functionality. And it's literally right there in your home. You've always been a proponent for that. And that's one of the things that always respected about you. And this is one of those things that, you kind of give your friends their flowers that they don't see what you see in them. And this is what I'm letting Dr. Janika know right now.
Oh,
She's
thank
always
you.
been such a great proponent of, being able to help you to be at your best through exercise. And I'm glad that she's doing that now for her patients in her own practice and also to help those who are going through it through midlife journey and also any of those who are going through it through any metabolic, insufficiencies or that they're having. So we love Dr. Janika. And because of that, we're going to ask her our fun question of the day before, as we end off this wonderful conversation. Alrighty. So, Doctor, when you were like going through it at your worst, what song would you say that would epitomize what lyric or song would epitomize how you felt when you looked at those 20 pounds just adding towards you, and no matter what you were doing, it just kept coming? What would you
Mhm.
say was a song that really came to mind?
Yes. I would say, wow, there are so many songs that I can think of, but let me
Mhm.
focus on one. So this song, I'm trying to think who is the artist of it.
Artist.
Song,
We don't know the artist. We know the song, but we don't
right.
know the
So
artist.
it goes like, let's go. If you want it, you can get it. Let's
So that's a song that was like hyping you up through that moment.
Yes, 'cause I wanted to figure out what was going on in my body.
Uh-huh.
I
I
really
love it.
wanted to. I was like, "Let me figure it out. Let
Uh-huh.
me, like, take a deep dive into what is going on." And also, because at the same time, I was, working for an obesity medicine company, and I was helping, people through their journey,
Right.
right? And I had seen that so often, um, we would resort to these GLP-1s, but they really didn't have a foundation.
Mhm.
They didn't have a foundation of, like, their lifestyle. And so I that's what I was trying to get to. And so
Right.
I've even curated my practice that way where I work for 3 to 6 months on lifestyle,
Mhm.
and then, when I look at your labs and all of that, and I see that, okay, it's clear that you need additional support, then I will add a GLP-1, right?
Right.
And
Yeah.
so it plays into how I even structured my practice. And so,
You
yeah,
were
because
like hyped up trying to figure
right.
it out.
Yeah, I wanted to figure it out, not just for me, but I also wanted to help my patients through their journey, as they were
Mhm.
navigating their own changes, right? And
Yeah.
so, it was twofold. It was for me and so that I can help my patients be
I
the
love
best
it.
version of who they could be. And so, yeah, so it was
I
like,
love
let's go. If you want it, you can get it. And I was like, listen, I'm getting it. I'm
I'm
getting it.
I'm
We're gonna
getting it.
figure it
I
out.
love it. I love it. And with that, you definitely have, because you've been helping so many, patients on their journey. And, from the standpoint of this podcast, so many of those women who are going through this midlife journey, they have that support. They're able to connect with you. Now, I know that you are practicing. Where are you practicing? If anyone wanted to be able to join your practice? Where?
Yes. Yeah. So I'm in Tennessee, Georgia, Indiana, Mississippi, West Virginia, Alabama,
Mhm.
Kentucky, Ohio, Wisconsin, and Minnesota.
It's a lot.
I
The
know.
Midwest. Just go down the Midwest and a little bit on the East and just come straight down and you got her.
Yes, yes. If I live in Tennessee,
Mhm.
it's mostly concentrated in Tennessee.
Absolutely. Well, with that, we want to definitely thank you, Dr. Janika Benoit, for stopping by the Menopause Stories podcast, telling us about your own journey and how you're able to offset that, and then how you're using their skill sets as not only an exercise physician, sports medicine, double board certified doc, helping that, but the fact is that you have the heart to really, really get deep down to the level of what's going on with the patients who are in your practice. So we thank you for helping those women who are out there. Now, I know before we jumped on, I said that I wanted this to be a conversation for our women that's out there. It's kind of like sitting down with a sister and just having a great conversation. So those of you who are listening and you're going through the same thing, you do not feel alone. And I hope that today's conversation was able to help you with just that. I think that today's is our first conversation diving into the exercise portion of menopause. And, we've talked about the metabolic portion, we talked about the metabolic health. I have a couple solo episodes where I do some deep dive, and we have some wonderful stories from some other high level women, those of us who refuse to take no as an answer because we're trying to figure it out. So I hope that this combination is helping you guys out there, you ladies who are out there, to not feel alone. The goal is for you to feel supported and for you to not go through this journey by yourself. With that, I want to thank you again for listening. Dr. Janika, any last word for our listeners out there?
I would say, even for the young women, right? The women in their 30s, because when I recognized my body was going through changes, I was in my mid 30s, right?
Mhm.
I would say, take inventory of your body. Make sure you understand what your baseline labs are, like your cholesterol, your blood pressure, your A1C. Know what those are because they can change, as you age and even during perimenopause and menopause. Mine certainly did. Right. So when I was going through the changes in my weight, my LDL cholesterol, it was never elevated. It was the first time it was elevated. And because I knew that, I was like, oh, something is not right here. And
Right.
so understanding your body, understand what your lab values are, your blood pressure, so that when you do check them again, you can recognize the changes.
Absolutely. I think that's a very, very important point. Understand. So, go and get your annual, ask for these in depth labs. And most of it should be part of your annual physical anyway. And if there are any changes going on, just be aware of these changes because this portion, as I said, I have in one of my episodes, that perimenopause period can be up to 10 years.
Mm,
So, you look at those of us in the 40s and 50s, and you're like, I don't gotta worry about that. Maybe you do once you hit that 35 mark. Just keep
mhm,
things in mind. So if you're having any changes going on in your body, ladies, or for those of us who are a little bit older, you have your younger cousin, your younger sister, younger friends, just make them aware, like, hey, changes can happen. So, just having an idea of what your baseline is a great way to start. Well, we hope that this was helpful to you guys. We're going to catch you guys next time on the Menopause Stories podcast. Thank you for listening. We do appreciate your time. Take care. Bye bye.